Hello, I'm Dr. Leong, a consultant chest physician. This is an extract of a video recording from a virtual workshop titled The Management of Cough and Excessive Phlegm. This video will briefly define postural drainage of the airways. This chest physical therapy technique uses gravity to help bring out the phlegm from the lungs. Thank you. Now, what is postural drainage? We use posture to bring out the phlegm. What does that mean? We use the advantage of gravity. All right? Liquid, be it mucus or phlegm or sputum, they're all liquid kind of substance. Only depends on its viscosity, whether it's thick or liquid fluid. So we use gravity to our advantage to bring out this phlegm. How we do that is by body positioning. You have to place your body in certain positions to drain certain areas of the lung. All right. We can use percussion to hit the abnormal airways, so that the mucus or phlegm is dislodged from the airway. All right. And we use compression to further hasten. So with compression, somebody has to do it for you. They need to be an assistant, all right? So compression to move the phlegm higher up, the mucus higher up. And then when it is high up in the airway, you do a huff and a control cough to bring it all out, all right? So just a picture showing the various segments of the lung. There are 3 lobes in the right lung, upper lobe, middle lobe, lower lobe, and 2 lobes in the left lung, all right? And there are many segments. So you can see from this diagram, of course it's not in 3D, some areas of the lung will be in front, some at the back, some on top, some at the bottom, right? So they're all in different regions of the lung. So the lung is actually this big, all right? Your lung is this big and this tall, all right? So it's very large. So they got the front part, back part, top part, lower part, all right? So you need to position yourself so that the abnormal area will drain correctly, all right? So this is what happens, body positioning. So how do we recommend, how does the doctor recommend positioning? It's actually from the CT scan, all right? So with people with bronchitis need to have a high resolution CT scan done, all right? So like this person, his abnormal part is this part, the right lower lateral portion of the lung is abnormal. So he lies in this position, the advantage of gravity to let the phlegm drain out. So with percussion and compression on the chest wall, the phlegm will be hastened to come out, and thus the huff and the control cough, the phlegm will be expelled. All right. Like in this person, the problem areas are the lower lobes, both sides, the basal area. All right. I'm sorry, the apical, and this is the basal. All right. The basal, so that's why he has to do incline. All right. Anterior basal, the top part at the base. This is the apex part of the lower lobe. All right. It lies this position. So there are various positioning. So we won't go into details of positioning. All right. But very importantly, the position will help bring out the phlegm quicker. All right. Aids. All right. Percussion cups for the assistant to use, or for self-administration. You don't want to be hitting your chest until your hands and palms are all swollen and painful. All right. There are also mechanical vibrators to help out.